Hello, my name is Kristen and I'm an ACHA physiotherapist at Flinders Private Hospital. This short video will outline information to assist your recovery and reduce your risk of developing a chest infection after abdominal surgery. Please remember that the information contained in this video is general advice only. You should always follow any specific advice and instructions given to you by your surgeon. Every day we breathe in thousands of bits of bacteria in dust particles and skin flakes in the air. This is unavoidable. The airways in our lungs have little tiny hair-like projections called cilia, and on top of these is a thin layer of mucus that our bodies produce. Dust particles and germs that we inhale stick to this mucus layer. The cilia create a conveyor belt action and sweep this mucus up towards our throat, where it would be generally coughed out or swallowed. It is normal to produce around 1/4 cup of phlegm every day without even realising it. If we aren't able to clear these particles and phlegm effectively, it can become a growth site for infection and may cause respiratory complications like pneumonia. When you have any surgery to your abdomen, a number of changes occur that can affect the way your lungs normally work. These occur due to a variety of reasons, including the location and type of your incision, the anaesthetic, the effects of some of the other medications, pain associated with the surgery, and that you may want to spend more time lying down and resting instead of your usual activity. These changes can last for at least 48 hours after your surgery. Your body produces more mucus than normal. The conveyor belt in the airways doesn't work as effectively. This actually doesn't start working properly again until you are up and moving around. Your cough reflex is weaker and less effective. Your diaphragm, the main muscle for breathing, doesn't work as effectively. Your breathing may be more shallow, so your lungs won't fill up as much as usual. These are some of the reasons why you are more at risk of a chest infection after abdominal surgery. The great news is that you can reduce your risk of developing a chest infection post-surgery. Walking and getting out of bed as early as possible after your operation is the most effective thing that you can do to reduce your risk of a chest infection. Walking also has the added benefits of reducing your risk of developing blood clots or DVTs and pressure sores. It can reduce feelings of isolation and also help promote bowel function, which can get a little sluggish after surgery. You should start walking with the assistance of your nurse or physiotherapist as soon as possible after your surgery, wherever possible within the first 24 hours. This can even occur on the same day as your operation if you are well enough. The earlier, the better. When you wake up after your operation, you are likely to have some attachments. This may include a drip, oxygen tubing, a catheter, wound drain, along with other monitors. These don't mean that you can't walk. This just means you will need some assistance, at least initially. Your nurse or physiotherapist will advise you when it is safe for you to walk on your own. Until then, please ask the staff for help. Remember, walking is a very important part of your recovery and no different than asking the staff for medication or to help with a shower. You should aim to walk out of your room at least 3 or 4 times every day, gradually increasing the distance as you feel better. It is important to continue regular walks after you discharge from the hospital to help regain your energy levels and aid your recovery. When you are lying down, your abdomen naturally tends to push up onto your lungs, reducing the amount of air in the bases of your lungs at the end of each breath. When you sit out of bed, gravity helps move your abdomen down out of the way, but also your pelvis tilts more forward, increasing the space between ribs and pelvis, which allows your diaphragm to descend better, and then your lungs fill with air more effectively, which is very important for shifting any mucus and improving your oxygen levels. You will be assisted to sit out of bed in a chair on the first morning after your operation. You should aim to sit out of bed for around half to 1 hour on your first attempt, Aim to sit out of bed 3 times on the first day with adequate rest time in between, with the goal to increase how long you sit out of bed each day as you feel better. It is better to do 3 shorter sits than only 1 long one, as the movement between the bed and the chair is also beneficial. Having an abdominal wound can make it more challenging to get in and out of bed due to discomfort when using your abdominal muscles. Making sure you have enough pain relief on board is really important. To make this easier and to reduce the strain on your incision, when getting out of bed, we suggest to first bend your knees up, move your hips and shoulders together and roll onto your side. You may like to reach for the bed rail or the side of the bed to make this easier. Dropping your feet over the edge, push up with your elbow or hand to get yourself into a sitting position. Remember to use the bed control to assist with this part in the first couple of days and ask for help as needed. If possible, it's also a good idea to keep one hand over your incision to provide a firm but gentle pressure during these movements. When returning to bed, we suggest the same technique, just in the reverse order. Deep breathing and coughing exercises are also important after your surgery, particularly in the first 24 to 48 hours when you are not yet moving as much as you normally would. Deep breathing exercises will help to re-inflate your lungs and clear any secretions, especially while your airway conveyor belt isn't working as effectively. You should aim to start deep breathing exercises as soon as you wake up after your surgery. Again, the earlier the better. Research has suggested that the timing of starting these deep breathing exercises may be critical in the reinflation of your lungs after surgery. It is very important that you are able to clear your lungs of any phlegm to reduce your risk of chest infection. This can be uncomfortable due to the incision in your abdomen. Therefore, you are encouraged to use a folded up towel or pillow, cough pillow, to hold firmly over your incision whenever you cough. This wound support helps to reduce pain and allows you to cough more effectively. You might find that this helps you complete your deep breathing and coughing exercises. Take 5 long, slow breaths. Try and fill out the bottom part of your ribs while keeping your shoulders relaxed. Pause for a few seconds at the top of the breath, then breathe out again. Do a couple of normal breaths to rest and recover. Repeat this set 4 times for a total of 20 long breaths. Holding your cough pillow gently but firmly over your wound, do a strong double-barreled cough like this. Pump your feet up and down 20 times at the ankles. Do this every hour when you are awake during the day. It is easy to lose track of time when in hospital and normal to be dozing on and off in the early days. So whenever you wake up again, perform these exercises and then hourly after that. Remember that the main message is the earlier you get up and out of bed and start walking, the better. The more you get up and out of bed and walking, the better. After you leave hospital, it's important to remember that your wound and abdominal muscles will take approximately 6 weeks to heal after your operation. Therefore, in the meantime, it is important to reduce excessive strain on your incision. We suggest to avoid lifting, pushing or pulling anything heavier than 5 kilograms for the first 6 weeks after your surgery. After that, you can start a gradual return to normal activity if your surgeon has advised that it is safe to do so. It is a good idea to check with your surgeon when you are safe to return to driving a car. We hope you have found this information helpful and wish you all the best for your surgery and recovery. If you have any questions, please touch base with the staff looking after you or consult your doctor.